Where are we locally in the COVID battle right now, especially considering we're about a month now from the big Christmas, New Year's holiday period?
Right now, I would say we're right at the peak. And for the last several weeks, we've seen the highest levels we've seen in terms of hospital admissions. The good news is that it does look like it's starting to stabilize. Over the last 7 days has been the first time we've seen a flattening of our hospital admissions, but we still remain in a very urgent state as it relates to managing the hospital capacity. We are seeing some encouraging trends in the community as it relates to tests. Our positivity test rate went from 26% down to about 18% over the last several days. So that is very encouraging.
Just yesterday, we did a story on a Forsyth Medical Center nurse who came out of retirement to help her colleagues there at the medical center, most specifically putting shots in the arms of people. Given that, I'm wondering, have you had enough staff members to handle this surge?
We've had over 2,500 team members that have come and volunteered outside of the hospital, whether it's retired nurses coming back to the bedside, whether it's nurses that currently work outside the hospital that have come back to the bedside. That has allowed us to really meet our duty of serving the community during this pandemic. And it's been nothing short of remarkable. And we have not seen any deficits as it relates to serving our patients.
We have video of the very first patient getting her vaccine. I believe she was in Clemens. And then just last week, you opened the mass vaccine clinic at the old Haynes Mall Sears store, capable of vaccinating some 7,000 people today. I'm aware that Novant purchased that Sears store a few years back. I was wondering if you can remind everyone why you did that and what was the original purpose for that Sears store prior to the pandemic.
We purchased Sears several years ago with the anticipation of using it for growth and strategy initiatives since it's so close in proximity to our main hospital campus here at Forsyth Medical Center. Little did we know we would use it for a vaccination site several years later in a pandemic.
How close is the number of doses that you're getting from the state to the number of doses you're capable of injecting into people's arms? And I would assume you'd certainly want those two numbers to be close.
Right now, we're receiving about 7,000 a week. We'd like to do 7,000 a day.
So you're not where you need to be.
We're not, but we're proud of the fact that every single dose that we're getting right now, we continue to administer effectively. We actually have appointments booked out all the way through May. Doesn't mean those are the only appointments we have, but we've been very deliberate about when we schedule them, knowing that we have the allocation. And as we get more allocation, we open those appointments up. So to date, we haven't had to cancel any due to that precise approach that we're taking with our appointments.
What can people who are watching this interview do right now to help you and your team members the most?
I would highly encourage people to seize the opportunity when they have access to the vaccine as we roll it out in their communities and as appointments become available. Our demand in the hospital is related to the prevalence in the community, which the vaccine can help with. And I think together we all can get through this in a very quick and rapid fashion.
You're good.